Alrighty, so we're back, about to knock out Chapter 2, Well-Being of an EMT. Again, for those that just joined, this is the lecture slideshow for the Emergency Medical Technician Basic. We're using the Emergency Care 14th edition Pearson yellow-ish book. And these notes are coming right from our lecture slides. So we're going to jump right in. The topics that we're going to cover are going to be well-being, personal protection, diseases of concern, emotion and stress, and scene safety. Well-being. Importance of well-being. Keeping yourself prepared for demands and risks of EMT is very important. If you're unable to function for any reason, patients may not get the care that they need. Maintaining well-being, maintaining solid personal relationships, exercising, sleeping, eating right, limiting alcohol and caffeine intake, and seeing your physician regularly and keeping up to date on vaccines. Personal protection. Where's that slide at? Personal protection. Standard precautions. Pathogens, you know this one, are organisms that cause infection. Pathogens can be bloodborne or airborne. Standard precautions include steps to protect self from pathogens. Make decisions about which standard precautions to use based on seeing the patient. The Occupational Safety and Health Administration, OSHA, has issued strict guidelines about precautions against exposure to bloodborne pathogens. Refer to local protocols for wearing personal protective equipment, and written policies also address what to do in event of an exposure to an infectious substance. The next slide is a picture of a bunch of PPE, gloves, latex gloves, masks, face shields, and glassware or eyeglasses. And it says always wear personal protective equipment to prevent exposure to contagious substances. Protective gloves. Always have vinyl or other non-latex gloves readily available. Gloves should be changed between patients. Probably see that on a test. Wear heavyweight and tear-resistant gloves when cleaning the ambulance and soiled equipment. To take off gloves, pull at the top of glove 1 and then pull glove 1 inside out. Hand cleaning, hand washing is vigorously wash hands with soap and water. Alcohol-based hand cleaners are considered effective by the Centers for Disease Control, except when hands are visibly soiled. Alcohol-based hand sanitizers can be used if soap and water are not available. Carefully, methodical hand washing is effective in reducing exposure to contagious diseases. Alcohol-based hand cleaners are effective and often available when soap and water are not. Going back to personal protective equipment, eye and face protection. Eye protection prevents splashing, spattering, or spraying fluids from entering the body. Should provide a guard from the front and from the sides. Masks. In cases where there's going to be blood or fluid splatter, wear a surgical type mask. In cases where tuberculosis is suspected, wear an N95 or high efficiency particulate air or HEPA respirator approved by the National Institute of Occupational Safety and Health, or NIOSH. Face shields offer protection for the entire face. Masks, a surgical type mask may be placed on the patient if they're alert and cooperative. I've seen that on some practice tests. When you cover a patient's mouth and nose with a mask of any kind, use caution. The mask reduces your ability to visualize and protect the airway. Let's see. Wear a protective mask and face shield when suctioning a patient. Gowns may also wear a gown to protect clothing and bare skin from spilled or splashed fluids. Wear a gown if a patient has an arterial bleed, is in childbirth, or has multiple injuries. Moving on to diseases of concern. If hepatitis B and C, infection that causes inflammation of the liver, can live on surfaces and dry blood for several days. Hepatitis B, HBV, is deadly, killed hundreds of healthcare workers each year before the vaccine was available. Hepatitis C, no vaccine yet, poses the same risk as B. Tuberculosis, TB, infects lungs, highly contagious and airborne. AIDS, HIV, HIV attacks immune system, leaving patient unable to fight off infection. And then AIDS, set of conditions that results when the immune system has been attacked by HIV. AIDS, lower risk for healthcare workers than hepatitis or tuberculosis, and contact with blood is usually route of infection. So wear that PPE, right? Ebola, people in the U.S. infected in 2000, people in the United States infected in 2014. Hemorrhage fever, and then a high rate of deaths, and lack of definitive treatment. SARS, we're going to talk about SARS and MERS. SARS is severe acute respiratory syndrome spread through respiratory droplets. MERS is Middle Eastern respiratory syndrome found primarily on the Arabian Peninsula. The avian flu found in poultry can affect humans, not easily transmissible from human to human. Influenza, around for hundreds of years. This date might be important. 1918 pandemic killed between 30 and 50 million people around the world. EMS can prevent the spread of flu by recognizing flu symptoms and placing a mask on any potential flu patient before entering the hospital. EMS personnel and other healthcare workers are at high risk of coming in contact with infectious diseases. Guidelines for the workplace safety developed by OSHA and the CDC. The OSHA standard on bloodborne pathogens requires infection control to be the joint responsibility of employer and employee. Joint responsibility. So we may see that. It's highlighted. EMS agencies provide training, protective equipment, and vaccines to employees. Employees participate in infection exposure control plans. Critical elements of the OSHA standard are infection exposure control plan, adequate education and training, hepatitis B vaccination, personal protective equipment, methods of control, housekeeping, labeling, post-exposure evaluation and follow-up. The Ryan White Care Act allows EMS providers to find out if they've been exposed to potentially life-threatening diseases while providing patient care. Designated officer gathers facts about potential exposure. 2 notification with the Ryan White Care Act, 2 notification systems, airborne disease exposure, bloodborne or other infectious disease exposure. Once notified of an exposure, employee will refer you to a healthcare professional for an evaluation and follow-up. Tuberculosis compliant mandate. OSHA's respiratory standard, it describes the selection and use of respirators. That's the OSHA's respiratory standard. Describes the selection and use of respirators. You are required to wear a NIOSH, NIOSH approved N95 or HEPA mask when you are caring for patients suspected of having TB, transporting an individual from such a setting in a closed vehicle, and performing high-risk procedures such as endotracheal suctioning and intubation. Immunizations for hepatitis B and other infectious diseases should be available through the EMS agency that you work for. There is no immunization against tuberculosis in the United States, but a tuberculin skin test, TST, can detect exposure to TB. EMS workers should be checked for exposure to TB on a regular basis, usually yearly, and local system protocols vary. Moving on to emotional stress. Psychologic aspects of stress. Stress is an inevitable in the whatever, you know what I mean? Here in the EMS profession, it is defined as a state of physical and or psychological arousal to stimulus. Know that is highlighted. Recognizing signs of stress and developing strategies to deal with stress are very important to the EMS career. Resilience means toughness or an ability to overcome tough situations. Helps EMS providers deal with difficult situations, helps understanding stress, being physically and mentally able to respond, and using techniques to mentally process difficult scenes. That's what resilience is. Body's response to stress has 3 stages. The first stage is an alarm reaction, fight or flight. Pupils dilate, heart rate and blood pressure increase. The second stage, the stage of resistance, which is the coping. The body system returns to normal functioning. And the third stage is exhaustion, loss of ability to resist or adapt to the stressor. 3 types of stress reactions are commonly encountered are acute stress reactions, delayed stress reactions, and cumulative stress reactions. Any of these may occur as a result of a critical incident. Any situation that triggers a strong emotional response. So any situation that triggers a strong emotional response. Got it. Makes sense. Acute stress reaction, often linked to catastrophic events such as plane crashes, LODs, line of duty deaths. Signs and symptoms develop soon after the incident. Physical, cognitive, emotional, and behavioral symptoms. Normal reactions. These include normal reactions to extraordinary situations. May or may not require professional intervention depending on the severity of the incident and severity of the signs and symptoms that are present. Moving on to delayed stress reaction, also known as post-traumatic stress disorder, PTSD. Signs and symptoms not evident until days, months, or even years after the incident. Delay in presentation of symptoms makes dealing with reaction much harder. Patient may not recognize what is causing the problem, and it requires intervention by mental health professionals. Cumulative stress reactions, aka burnout, not triggered by a single event, results from years and years of sustained low-level stressors. Early signs are vague anxiety, boredom, and apathy, and emotional exhaustion. Progresses to physical complaints, loss of emotional control, irritability, and depression. May present as severe withdrawal or suicidal thoughts requiring a long-term psychological intervention. Ultimate key to preventing or managing cumulative stress lies in seeking balance in our lives. Moving on to the causes of stress. Multiple casualty incidents, MCIs, calls involving infants or children, severe injuries, abuse and neglect, or death of a coworker. There are 2 types of stress. I know I'm going to pronounce this wrong, but eustress, EUSTRES, positive form of stress that helps people work under pressure and respond effectively. and distress, negative stress causing immediate and long-term problems with health and well-being. Signs and symptoms of stress include irritability, inability to concentrate, changes in daily activities, anxiety, indecisiveness, guilt, isolation, and loss of interest in work. Dealing with stress, making some lifestyle changes, develop more helpful and positive dietary habits, exercising, devoting time to relaxing, and shift your location from lighter call volume, different types of calls, and more family time. Invisible wounds, preventing psychological trauma. Psychological trauma can result from tragic scenes. System that takes in stimulus from a traumatic incident may malfunction. Invisible wounds, there's way to prevent psychological trauma after a traumatic incident. The Northeast Resilience Something and LaGuardia Community College in New York City developed the ESCAPE curriculum to help patients and EMS providers deal with post-traumatic stress. The ESCAPE curriculum, E stands for every patient, even routine calls. S stands for social support, prevent feeling of isolation. C stands for choice and control. Choices give sense of control. A, anticipate, reduce anxiety and prevent unexpected. P, plan and organize, reduce bewilderment and loss. And E is for every time. So look that up, be kind of aware of it. Critical incident stress management is a comprehensive system, includes education and resources to prevent stress and ways to deal with stress appropriately when it does occur. Critical incident stress management. Critical incident stress debriefing, CISD, designed to help responders diffuse after an incident. It's usually a team of trained peer counselors and mental health professionals that meet with the rescuers and healthcare providers involved in a major incident 24 to 72 hours after the incident. I've seen that on a practice test. Help responders deal with stress, so know the 24 to 72 hours. Understanding reactions to death and dying, emotional stages, denial, which is not me, anger, which is why me, bargaining, which is okay, but first let me, depression, okay, but I haven't, acceptance is okay, I'm not afraid. Dealing with stress, understanding reactions to death and dying, recognize the patient's needs, be tolerant of angry reactions from the patient or family members, listen empathetically, do not falsely reassure, and offer as much comfort as you realistically can. Moving into scene safety. Scene safety, EMS, not usually a dangerous profession. Being aware of potential dangers is always a priority, and determining scene safety will be the most important decision on any call. So that's highlighted, I would know that. Primary rule is to maintain a safe distance from the source of a hazardous material. Placards, ensure that your emergency vehicle is equipped with binoculars. Correspond with coded colors and identification numbers that are listed in the emergency response guidebook. Your most important roles at the scene of a hazardous materials incident are recognizing potential problems, take action for personal safety and the safety of others, and notifying a trained hazardous material response team. Do not treat patients until they have undergone decontamination. There's a picture of an officer with binoculars looking at some placards from a distance. It's really wanting us to do that. Terrorist incidences may be small or large in scale, may include chemical agents, biological agents, radiation weapons, and or explosive devices, IEDs. Rescue operations, rescuing victims from fires, auto collisions, explosions, electrocutions, and more. Evaluate each situation and ensure that appropriate assistance is requested early on in the call. Never perform acts that you are not properly trained to do. We're almost getting to the end of this now. In some situations, you will have to make a calculated decision between helping or personal safety. Know that despite your best efforts, some patients will die. Scene safety and well-being are determined by the decisions that you make under pressure. Violence. When responding to danger, plan, observe, and react. These are highlighted. I think we're probably going to need to know them. Plan. Wear safe clothing, prepare your equipment so it's not cumbersome, and carry a portable radio whenever possible. Decide on the safety rules. Observe, which is the second one now, is to survey scene as on approach. Do not announce arrival and turn off lights and sirens. Observe also includes violence, crime scenes, alcohol and drug use, weapons, family members, bystanders, perpetrators, and pets. There's a picture of two EMS techs that are knocking on a door, but they're standing to the side of the door as not directly in front, just in case things go south. React to danger, the 3 R's: respond, radio, and reevaluate. Do not re-enter a scene until it has been secured by police. Never enter a scene that is potentially violent until the police have secured it and told you it is safe. React to danger, flee, get rid of any cumbersome equipment, and take cover and conceal yourself. Concealing yourself is placing your body behind an object that can hide you from view. And we're going to do a quick chapter review. Your well-being is an important concept. This chapter has provided several ways to protect and maintain it. You should never take safety or standard precautions lightly. Each yields an important decision you will make at least once at each scene you respond to, always. Protect yourself from violence and scene hazards at all costs. Protect yourself from disease. Do not be paranoid about catching a disease, but take appropriate precautions. Resilience means toughness or ability to recover quickly from a difficult situation. It is important for all EMTs to remain physically and mentally strong. Stress may be an immediate reaction from a particular call or cumulative from a combination of life and EMS. Both kinds are bad for you. Seek help if you need it. You will see death and reaction, and you will see death and reaction to death. Each is very personal to those involved. The stages of death are denial, anger, bargaining, depression, and acceptance. Second time we've seen that, so know that. Treat people who are under stress fairly and compassionately, even if it's difficult to do so. Last slide. And remember, scenes are dynamic and can change in an instant. We'll probably see that on the test. I've seen it on other tests. Assessment of scene safety is an ongoing process. And don't be so focused on the patient that you lose perception of what's happening around you. That concludes chapter 2. Read it, listen to it on your way to class, listen to it when you're laying in bed and you can't get out your book. And then we'll move into lecture number 3. Thanks for listening.